Hello, everyone who's joining. We're just going to give it a minute to let everybody get in. Did you have a question, Cynthia? If you do, feel free to drop it in the chat and my team will be able to see it. Okay, it looks like everybody's here, so we're going to go ahead and get started. Welcome. We're excited to have you. Hopefully, you're here to hear about NATRC's Trauma Recovery Center Demonstration Grant Project. I am Janelle Malone, Senior Director of the National Alliance of Trauma Recovery Centers, and we are really excited to tell you about this opportunity. A few housekeeping items. This webinar is recorded and we are going to put it up on our website where the NOFA is located after this. We will also put up the PowerPoint slides, so don't worry if you don't capture something as we're going through. This meeting is set up in webinar format, so cameras are off, chat is disabled. You can only chat with the host and my team behind the scenes. And all of your questions need to be put in the Q&A box at the bottom of your screen. You can put those in at any point during this PowerPoint, but we will get to them at the end after I've gone through the whole project. We are a small but mighty team. We do have limited technical assistance during this webinar, so if you're having any issues with audio or anything else, we can try and help you, but we may not be able to, given kind of everybody in all the moving parts, everybody having a role. There is captioning available for this webinar as well. If you want to enable that, again, it should be at the bottom of your screen. You should just be able to click on caption, and you should be able to see that from there. Because this project is funded by the Federal Office for Victims of Crime, we have to put this disclaimer up on the screen. Basically, everything that I'm going to say today is NATRC's own views, and nothing I say is necessarily represents the Department of Justice, the Office of Justice Programs, or the Office of Victims of Crime. So NATRC. If you made it this far, I'm hoping you saw us on our website and you were able to look a little bit into what we do. But NATRC was established in 2019, and we're a membership organization comprised of 53 trauma recovery centers across 14 states. We offer a learning community to share best practices, innovations, emerging trends and issues, and to support the TRC network. By expanding our network, we serve as a catalyst to advocate for equitable, comprehensive, client-centered care for all victims who've experienced violent crime. And the UCSF TRC model was established at UCSF, the University of California, San Francisco, in 2001. The model's a proven, cost-effective approach to provide comprehensive services to all victims of violent crime, especially those who aren't historically reached by traditional services. So TRCs offer wraparound care and support to stabilize and stabilize the lives of victims and survivors, as well as support for healing. And I may use victims, I may use survivors. For me, it's interchangeable, but just so you know, I mean the same thing. There are 11 core elements to the UCSF TRC model. The first is assertive outreach, which means intentionally engaging with vulnerable populations that are facing barriers to care to create equitable access to services for all survivors. The TRC model also advocates for services to victims of all violent crimes. So many programs have stipulations or only serve, say, crimes against women or youth or any other specific category, whereas TRCs are open to everyone, which is really important because many survivors don't have a place to go when they're victims of robbery or assault or gun violence or all the other types of crimes that can be experienced. Comprehensive services offered by TRCs include mental health and support services. This is typically crisis intervention, case management, and assertive outreach. This includes meeting survivors where they're at. So meeting victims out in the community. It could be in home services or in other locations or community partner locations. The TRC model is made up of a multidisciplinary team of master's level clinicians, psychologists, and psychiatric care. The expectation is that these folks are on staff at the TRC organization, with the exception of the psychiatric care, which could be contracted out. Typically, the multidisciplinary team is comprised of social workers, marriage and family therapists, professional counselors, as I stated, at least one psychologist, psychiatric care to make sure there's access to medication management. And often we see other types of positions at TRCs like caseworkers or outreach specialists or something of that nature as well. The TRC model follows a coordinated care model, which means a single point of contact with integrated team support. So it's essentially, again, that wraparound service model where the multidisciplinary team is coordinating services for that individual, but there's a single point of contact at the TRC that works with that individual to make sure all their needs are getting met. The sixth core element is clinical case management, and that combines case management such as like criminal justice system accompaniment or meeting emergency basic needs like housing stability or emergency relocation or uh, emergency food, transportation, things that come up that are vital to making sure we set survivors on their healing path. The seventh core element is inclusive treatment. The TRCs embrace survivors with complex challenges, and they don't exclude survivors based on substance use or low motivation or behavioral issues resulting from trauma. So when we say that TRCs serve those who are typically left behind or fall through the cracks, that's really what we mean. This truly is available to everyone, which I'm jumping ahead to core element 11, but we'll circle back. Number 8, evidence-based practices. TRCs have trauma-informed interventions, including all these types of evidence-based therapies that are listed on the screen and culturally rooted healing practices. Evidence-based practices typically mean those that have been identified nationally or internationally by recognized trauma experts, and those are all listed in the core elements document, which is Appendix E in the notice of funding availability. So all this you can find on our website. The ninth core element is goal-driven. TRCs focus on addressing the impacts of trauma, and the primary goals are to decrease distress and stabilize victims and improve the overall quality of life. The 10th core element is accountable services. This is the TRC model is structured for survivors to receive up to 16 sessions of therapeutic care, and that can be extended based on clinical need in consultation with the clinical supervisor on staff. And as I already noted, everybody's welcome. Services should be provided regardless of immigration or citizenship status. And the culture of a TRC should be trauma informed and healing centered. In a randomized control trial conducted at the San Francisco Trauma Recovery Center, the UCSF TRC model was found to significantly improve engagement in mental health and victim services compared to traditional approaches. The model was found to be more cost effective than fee-for-service models, and it truly does reach individuals that are experiencing the most complex challenges like housing instability, unemployment, and other access barriers. So through a grant made possible by the Federal Office for Victims of Crime, we were able to create this demonstration grant opportunity to replicate the TRC model. A group of individuals from national partners in this work serve on an advisory committee to guide us in this project. And they took a look at an analysis of the United States, and some of the criteria that were looked at were cities that are larger than have at least a population of 100,000 or more. And then we also looked at whether or not there was any TRCs, there's any TRC presence at all, or whether there's a dedicated state funding source for TRCs. And we were specifically looking for areas that didn't have either of those items. Then we also looked at typically the factors that the CDC lists that we know increase the vulnerability and really put people in situations where they're more likely to experience violent victimization. So things like poverty, unemployment, rates of violence. I'm trying to draw these off the top of my head, sorry. But you probably get it. We were really trying to find where we could have the most impact. And through that analysis, the advisory committee chose these 5 target cities: Birmingham, Alabama, Memphis, Tennessee, Jackson, Mississippi, St. Louis, Missouri, and Milwaukee, Wisconsin. So for the purposes of this project, the only eligible programs are those that are serving in those cities. A quick funding overview: a total of $3 million is available for 3 to 5 pilot sites over 2 years. The most that can be requested for each of the individual 2 years is $500,000 for a maximum total of $1 million per site over the 2-year project. Award amounts could be less than $500,000, less than that 500,000, but they won't exceed that amount. And when you apply, you will only be creating a 1-year budget. Because of the implementation and sometimes the path to getting to that implementation can look different for each project site. So it's a little bit easier to be kind of accurately projecting that year 2 budget closer to the end of year 1 based on the status of your project. So that's why we only have you do one. I'm going to pause real quick. Sounded like I might have froze. Did one of my teammates want to hit me up and make sure that you guys can still hear me? Okay, I'm getting the I'm good sign. Eligible applicants. So again, located in one of the 5 target cities, you must be an organization that is either an organization of higher education, public or private, state-controlled institutions. You can be a 501c3 or a non-501c3 nonprofit, and tribal organizations are also allowed to apply. So anyone that falls in these categories are eligible and exists in those cities are eligible to apply. This is a reimbursement-based grant because it's federal monies and because there are federal rules behind it. That means you have to expend money first and then you get reimbursed for those actual expenses after you've incurred them. There is the possibility that grant advances may be provided on a case-by-case basis with sufficient justification as determined by NATRC. So the typical kinds of costs that we see in a TRC budget are all listed on the screen. This list is not all inclusive, and applicants are encouraged to look at the links to the federal resources that we put in Appendix G in the NOFA if you really want to get well versed on information on allowable costs. Just a point of clarity, NATRC may deem some costs that are federally allowable to not be expenses that we want to prioritize in this project. For example, we are not allowing successful applicants to subaward to other agencies at this time. So that means we won't allow you to apply and then serve as a pass-through to another organization who will actually be providing the services. This is truly due to this being our first time around with this, and because our capacity and experience with this process is just, we're at a place where we want to be sure we're getting everything right before we, truly, expand. But we're hopeful that given this is a demonstration project, that if we can demonstrate success to OVC, we will get continued funding in years 4 and 5, and potentially we would be able to open it up and have that opportunity available in the future. But for now, you won't be able to subaward to another organization. Not to be confused with contracting, but that's a different conversation. Unallowable costs. So the current slides highlight the most common unallowable costs under this federal funding source. In each budget category within the budget detail and narrative template, we've provided the appropriate section and chapter to the Code of Federal Regulations, this 2 CFR, the Code of Federal Regulations, so you can make sure you're requesting eligible costs. Successful applicants who've included unallowable costs, we will work with you after you've received notice that you're a successful applicant to finalize your budget and repurpose any unallowable costs. So it doesn't automatically like exclude you from the process, but when we go through that budget negotiation process, we'll make sure that you're shifting any money out of things that can't happen to other categories where you can use those funds appropriately. During this project, there will be some required training and technical assistance that will be provided to you. That's us, that's NATRC, that's what we do. So on the screen, we've kind of laid out the time commitment so you can kind of plan accordingly as you're mapping out your proposal narrative. These are all meant to help you implement or enhance how you expand to become a TRC. We've been doing this for a long time. My team is amazing at this. So our goal is to help wrap you in support so that you get whatever it is you need to be able to implement this model to full fidelity. One thing to note too is that there will be an in-person convening at a TRC location to be determined in the future. So it's written here, it's also in the budget and in the NOFA, but we do want you to budget for at least one individual in leadership to attend that in-person gathering when we decide the date and time and location. You'll also be required to collect data around kind of quantitative and qualitative information as well as financial information. There are reporting requirements that we have to pass down to you that are federal requirements. And then there are also outcome measures that we have used specifically for the TRC model that are really outlined in Appendix F, which is the base TRC logic model. So while we only list here the ones that are required by federal funds, just know that there will be another report that will make a whole lot more sense, that will really get in depth with the folks who are successful in obtaining these awards. So we'll make sure you're set up for success, but we really want to, we want to be able to measure whether or not survivors are getting what they need. And to that end, we also have a project partner who will conduct program evaluation. That's the Research Triangle Institute. So they're going to work with all the programs, have virtual meetings, and again, be making sure that we're setting this up so that we can measure success. The application. So this is kind of the meat of why you're here. On this slide, you'll see required components. Each section is outlined in the NOFA in pages 17 through 19. The application submission form also separates out each required section to help make sure that you include everything, that you don't miss any of these required components. A couple things to point out: the proposal narrative cannot exceed 15 pages. Any pages after that limit won't be reviewed or scored. And if the omissions are substantial enough that we can't actually wrap our heads around the entire project, the proposal might be deemed unresponsive and removed from consideration. So do not exceed the 15-page maximum. That does not include the budget detail and narrative or any of the other attachments. It's solely the proposal narrative. Some other things to mention: resumes or CVs of staff are required to be included with your application for any positions that you're listing in the TRC budget who are already staff, who will be filled, with staff who are already employed by the agency. So if you already have somebody working for you that would be stepping into a TRC role, we want their resume or CV. For any of the positions that are vacant or that you would be hiring for, we'll get those at the time of hire if you're successful in obtaining this award. So no need to worry about that on the outset. The time task plan, we've provided you with like 3 or 4 template samples. That was just to give you an idea of what we're looking for. You do not have to use any of them. You can use something else if you're used to writing grants and have something that works better for you. But a time task plan is required. So please be sure that you include that. For letters of recommendation, you can submit a maximum of 3. The letters of recommendation should be individual rather than template letters. The substance really matters to us. We want to understand the collaborative relationship between your agency and the recommending agency. It's important to note that we have no expectation that applicant agencies have all of the components of a TRC going, and implemented at the time of application. That's the purpose of the project. We don't even expect you to have them in place at the start of the project. So we want to understand if your agency is a good fit to become a TRC by assessing whether or not you understand the core elements of the UCSF TRC model and what your plan is to enhance services to become a TRC. So as I noted a couple of slides ago, all successful applicants will have the support and guidance of the NATRC team to implement all of these pieces. Also, it's important to note that reviewers may not be familiar with your agency, so please write your application keeping that in mind. You will only be assessed based on what you've put in your proposal or application. So we're not going to go do website searches and track down information for you. And our team of reviewers will be made up of both internal and external professionals that have experience in this field. So there will be a lot of eyes on these. And folks will be coming through the lens of knowing what a successful TRC looks like. Narrative question number 1. Okay, just doing a time check to make sure that I'm not too far behind. In this question, we want to understand who you serve, the types of violent crime victims you see, your history providing services, and your community partners. Each of the 5 target cities have really robust CVI, community violence intervention prevention, and or hospital-based violence intervention and prevention programs. It's really important to us to understand either how you will or how you are already partnering and engaging and collaborating with these organizations. These are 3 distinct service models that have different outcomes, but the individuals being served definitely overlap across the 3 programs. So we want to be sure survivors are getting what they need, and we want to understand whether these partnerships currently exist or how you plan to develop them in the future. Narrative question 2. In this question, we want to understand who your community is and how well you understand their needs. This service model is meant to reach, again, the folks who typically fall through the cracks. Again, those with the most complex barriers and folks from diverse cultural backgrounds. So we want to understand that you already have connections to those communities. In question 3, the multidisciplinary team. We really want to understand how you will staff and how you will train staff of your program to provide TRC services. We want to understand your employees' qualifications and experience, and how you ensure you're providing that healing-centered, trauma-informed service. We also want to understand all staff who will contribute to the TRC so we can get kind of that full view of who will be working on the project. So if there are individuals who will be providing services under this grant project but won't be funded by this grant project, we still want to hear about them in the narrative. Just please don't list them in the budget. If they're not going to be paid for out of these grant funds, then they shouldn't be in the budget. The 4th question, we really want to understand how well you understand the TRC model. So again, we've given you access to the UCSF TRC manual, which is an incredibly comprehensive outline of the TRC model. And we've also given you the 11 core elements of the service model. Hopefully you're looking at those and you already see your agency as fitting into those. You're doing a lot of them already, or you can see an easy path to getting there, because that's what we want to understand in this section. So that's what all of the questions are getting at. And for the last question, we really want to understand what your experience is and what your plan is to capture, store, protect, and report data. There is quite a bit of information to be captured so that we can be showing or measuring that success that I spoke of earlier. So we want to know what that looks like for you. We want to know what system you have or what system you might plan on getting if you don't have one already, because all of these different components will have to be collected. We did put templates, again, in the appendices. The letter fails me, right? Or it's not in my head right now, but we did put the templates of the required federal reporting performance reports. so you can go see exactly what would be required of you. But again, know that there will be an additional reporting requirement for those outcomes that I spoke about. The scoring criteria. So, as you may notice, what we care about most is what you say. So, we really want to know how you're going to do this from start to close, from the second you see a client, from really truly from outreach to clients, that assertive outreach to client intake and service provision, all the way through to close out. So, that's really what we're looking for in that proposal narrative, which is why it has the greatest number of points. The total application, the point total for the application is 100. So the proposal narrative is 60% of those, or 60 points. The budget detail and narrative is worth 20 points. The time task plan, 10 points. The client flowchart and the letters of recommendation are each worth 3 points, and the title page and organizational chart with those resumes and CVs are worth 2 points. And hopefully that adds up to 100. Key application dates. On October 15th, we released this NOFA. Obviously, we're holding the webinar today. You will be able to submit questions today that we will try to answer live. We will also be accepting any questions through the form on the NOFA page up through November 21st. We will be putting the responses to those questions up on a rolling basis. So we're going to try and put that information back out as you guys are crafting your applications. But the final update to the Q&A will be posted on December 1st of this year, giving you hopefully roughly a month to look at those and be able to incorporate any clarification or information we put there into your final application. There's also, sorry, let me pause. The due date, the most important thing, December 22nd, 2025, 12 p.m. Pacific Standard Time. Our organization is based out of San Francisco. I recognize all of you are in the Central Time Zone. So for those of you in the Central Time Zone, that is 2 p.m. your time. So please do not miss that. We cannot accept late applications. We hope to be awarding the money and announcing that on January 23rd. We will put an announcement on our page as well, but we will make sure that everybody hears. So even those who are unsuccessful will receive something from us when we make those award announcements. And then, as I noted, March 1st is the expected project start date. What I was going to say is there's also an appeals process that I'll walk through in a couple of slides. So there are some requirements on how you format your application. We do want the proposal narrative to be double-spaced in 12-point font, 1-inch margins, again, 15 pages max. That doesn't include any attachments or the budget. Basically, we just want to be able to read it. So we don't want you to put it in an 8-point font to get everything in there that you want to say in 15 pages. So please be sure to follow these because you may lose points if you don't. As noted on the application form, if you've gone in and looked at it already on our NOFA, you will not have the ability to save your application and come back to it. So we recommend writing and compiling everything you need outside of the system, and then you do your editing and quality checking, and then upload each required attachment and submit all at one time. This is not a grant system, so it should be real easy to use. But if you have any questions, we're here to help. You can reach out. My contact information is on the screen. Again, the deadline, December 22nd at noon Pacific time, 2 p.m. Central Time. Late applications can't be accepted unless there's a technical error on our end. We know it's tempting to wait until the last minute. I have written a million grant applications, and it is so hard to want to be the guy that puts it in there early, but we are encouraging you to do just that. There could be technical issues on your end, so plan for that, right? If you're doing it early, then you don't have to worry about getting it in on time, because none of those will be reasons why we can accept your application after that. You will receive an email confirmation that your application has been submitted. Typically, this is almost immediate. But if you don't receive that within 24 hours, feel free to reach out to me. I can confirm whether or not we've gotten it. But you should be seeing that, that confirmation come through to your email, whomever it is that submitted that application, almost instantly. And any questions about the application itself after this, again, has to be submitted through the Q&A form. So please don't reach out to me via email to ask me questions about the NOFA or the project. Please put those in the Q&A form that's on the website. And the reason for that is just we want to be sure we capture all of these questions and that we put that information out for anyone who's thinking about applying so that everybody has the same information. There's no advantage given to anybody. Federal compliance requirements. So if you've ever gotten federal money before, you know that there's quite a bit of bureaucracy. We do our best to mitigate that, but we want to point out a few things that that are absolutely necessary. So you have to be registered in SAM. SAM.gov provides your organization with a unique entity identification number, or a UEI, and you have to have that in order to be able to get this grant. So if you don't have one already, please go do that sooner rather than later. And you have to maintain active status in SAM.gov throughout the award period. This is how the federal government both reports on their end about who's getting their money, and also how they track like high-risk grantees and debarment or a blocking or barring of organizations from receipt of federal funds because of any kind of compliance issue in the past. So please get that done early if you can. Background checks are also required for all staff with access to vulnerable populations. That includes a fingerprint search, and that has to be completed before that individual would have unsupervised access to clients. This is something that we'll talk a whole lot more about with successful applicants. So not huge on the front end, but something you should know. And then also you have to make sure that you're protecting personally identifying information, and that you're requiring or you're obtaining informed written consent from clients before releasing any data. Again, this can all be found in the Code of Federal Regulations, 28 CFR 94.115. And if you don't get it from here, again, once you're in the actual application or the NOFA itself, we point you to all these sections again so that they're a little bit easier for you to find. Time and effort documentation. We put this into this presentation because it's important for you to know that any staff who will be performing grant activities will be required to track actual time and effort spent on the grant. This is a federal requirement for any DOJ funds. While you can estimate time to be spent on the grant in the budget, you can only charge actual time spent on the grant, which is why you need to track that time. So timesheets will require the employee certifying what they've put on there and the activities and time that they've spent on the grant. And it also requires the signature of a supervisor or someone in leadership with direct knowledge of that employee's work. This trips up a lot of subrecipients who get federal money, which is why we're saying it now. It's the most common audit finding at the federal level. So we will absolutely be revisiting this, providing sample templates and guidance to make sure that you're set up on the front end again for success. So we'll do that through grantee orientation once awards are made. But if you can plan for it in advance and have these in place, that's best, obviously. So again, because these are federal funds, there are compliance requirements that we must follow. We approach compliance through a technical assistance lens. You obviously have to follow the rules, but we want to be sure you know what those rules are and how to make sure that you don't make mistakes inadvertently. At times, we may have to come on site and review financial backup documentation and or programmatic or reporting information. We'll also be working closely with you to assist with that project implementation and to evaluate the progress on your goals and objectives. And as noted earlier, our program evaluation partner, RTI, or the Research Triangle Institute, will also be doing simultaneous evaluation with all the programs, again, measuring success so that we can demonstrate to OVC that this is something they should invest in the future. The appeals process. If you're not successful in getting a grant award through this process, you have the opportunity to appeal. Appeals are due to us by January 30th, 2026 at noon Pacific Standard Time, 2 p.m. Central Standard Time. The review is going to be conducted by folks who weren't a part of the process of reviewing the grants themselves. And those final decisions we hope to have issued before or on February 6th of 2026. Appeals can only be made based on scoring errors, an allegation of bias or discrimination, and or procedural noncompliance. So appeals are not allowed solely based on the applicant's disagreement with the professional judgment on the proposal quality or the narrative contained therein. Again, we have folks that will be reviewing these who have been doing this work for a very long time and know what successful TRCs look like. So they're coming with that knowledge, and that's the lens they'll be looking at your applications through. So you don't have somebody who isn't familiar with what this should look like looking at these grants who may not understand what we're trying to do. Support resources. Again, we'll take questions on a rolling basis and respond both directly to the submitter, and we'll post the questions on the website. So please be looking back on occasion to make sure that we haven't put out something that might impact how you would craft your grant application or any of the attachments that are required. We again will accept those questions until November 20 or through November 21st, and the last posting of the question responses will be on December 1st. Just a reminder, the webinar, the PowerPoint, the webinar recording and a transcript and the PowerPoint slides will all be made available on the website as soon as we're able to convert them, edit them, and get them up. Hopefully here in the next few days, probably by midweek next week at the latest. You'll also find the UCSF TRC manual on our website, as well as the core elements. There's a lot of information on our website, but these are the two documents we're really pointing you to as you craft this. You're obviously welcome to use anything that's out there to help guide you. But we definitely recommend you review the manual and the core elements before you apply. So why this matters. The TRC model offers a powerful evidence-based approach to healing that transforms outcomes for survivors of violence and strengthens community resilience. I've only been with NATRC for about 3 months, but I had a hand in laying the foundation for the first trauma recovery center in the state of Iowa. This is a model I believe in because it reaches populations who often get overlooked and are not reached by traditional services. And it not only provides stability in case management and support, but also provides those healing pathways through therapy, which is really important given the stigmas that are around many communities around obtaining healing opportunities like therapy. So I absolutely love this model for that reason. I truly believe it changes lives. So we're incredibly excited to be able to offer this opportunity and replicate this model in 3 different states. And we're really looking forward to seeing the applications come through from each and every one of you. Here's my contact information. I'll leave it up for a couple of minutes. Also posted are the website resources. All of the NOFA information is on our website, as well as the questions and responses that will eventually be put up. That's also where you have the application portal, which is an application button. Hopefully you can find it. We made it as big as possible. And again, you'll get in there and you'll upload each individual section that's required for the application, and then you'll be able to forward it on to us and submit it. Once you've submitted that, agencies can only submit 1 application, so please do not submit multiple. And once you've submitted it to us, it cannot be changed. So be sure you're submitting the final version of your application and double checking before you click submit so that you've given us the best version of what you've created. And again, those confirmation emails will be sent hopefully almost immediately, but definitely within 24 hours. And if you don't see it, then you can reach out to me. And the application deadline, December 22nd, 2025, 12 p.m. Pacific Standard Time, 2 p.m. Central Standard Time. Please don't miss it. We're very excited for this opportunity, and we hope you are too. Okay, I'm going to end the slideshow, and we'll shift. You can see the million tabs up on my screen. We'll shift to question and answer. Hopefully there are some questions. If there aren't, put them in there now. And my colleague Stacy is going to be reading those to me since I cannot track them.
Okay, we do have a number of questions in Q&A, so we'll start with the first one and go down the list. Question number 1, is it correct that you have to have a nonprofit to apply for this grant?
So the eligible applicants were discussed earlier in this PowerPoint. You have to be either a state or public institute of higher education, a private institute of higher education, a nonprofit with a 501c3 status, or a nonprofit without a 501c3 status, or a tribal entity. So you have to fall into one of those categories and be a program that's serving in one of those target 5 cities to be eligible for this money.
Okay, our next question is if we have a nonprofit and have a partnership with another agency that is not a nonprofit, are we able to contract out for services with that other agency in an MOU?
So unfortunately, as I noted earlier, we are not allowing subawards at this time. So we will not allow a lead agency to apply, receive the money, and then pass it through to another organization. It's also contrary to the UCSF TRC model. For all the reasons I identified through the 11 core elements, the model has been shown to be most effective when those individuals who are serving are on staff at the organization. And the one place where we allow some leeway with that is really around the psychiatric care and medication management. That can get super expensive in places, and also it's not always as easily accessed. So we recognize that, and that's the one place where we have seen contracts be successful in the past. But the expectation really is that you have these folks on staff. Hope that answers that question.
All right, next question. I am at an institution of higher education that is outside of the target cities, but partnering with a community-based organization that is in one of the target cities, and hence the project would be based in and serve the target city. Am I allowed to apply through my institution of higher education?
I hesitate to answer this question because I think this is touching on the subaward issue that I just noted, which is that we don't want a lead applicant applying and then passing through the money to someone else to serve, to predominantly provide those services. I would encourage that organization you're referencing to be the one to apply if they're best situated to serve the community.
Okay, next question is, can an HFIT program apply?
As long as you meet the eligibility requirements that we've outlined, the 3 different types of organizations, nonprofit, tribal, institute of higher education, and you're located in the city, you're eligible to apply.
Okay. Our next question is, since this is a reimbursable grant, will advance pay be given to get started to allow for hiring of staff, any data systems, supplies, etc., that might be needed to start?
It's a great question. Advances may be available. And the reason I say may is because, as I noted, this is our first time subawarding and building a project like this. So I'm being fully upfront with the fact that we want to be sure we're getting things right so that we don't put any of our subawardees in a place where they're not getting something right. So we're currently working through our processes to put that in place. We hope to be able to offer that. The federal government would prefer it be reimbursement based if you're familiar again with any DOJ or OJP funds. But we recognize that that can be a barrier for some. So we're trying to put that process in place right now. So you're welcome to ask, and with justification, we will try and make that work if you are the applicant that rises to the top.
Okay. Next question, is there a limit to how many organizations we can include in our application for the grant?
Depends on what is meant by organizations included. If you're wanting to subaward, that's not, you shouldn't be creating your application in that way. If you're meaning you partner with a lot of community agencies, absolutely explain what that looks like. I think that helps bolster your claim that you're tied to community and that you're well suited to expand to become a TRC.
Okay, next question. If you already receive an OVC grant for this type of work, does that disqualify you?
I might have to have an internal conversation about that, because I feel like that's a question OVC may have to weigh in on. It does not automatically disqualify you, I can tell you that. But I do know that OVC tries not to duplicate funding. So if in fact there is an award, although there shouldn't be an award for a trauma recovery center. So if you're getting an award for like hospital-based violence intervention services or meeting the basic needs of underserved survivors, I'm trying to think of the different applications that have come out recently. I don't think that that would be problematic. However, you cannot duplicate funds. So you can't be asking for us to support positions that are already included in a different federal application. So that's important to note.
Okay, next question, and this is our last one in the Q&A right now. We serve LGBTQIA plus clients in Memphis, Tennessee. Can we continue to serve that population, or would we have to expand to serving everyone?
The expectation is that you serve everyone. Um, if I feel like there's a difference between everyone is welcome and who you target and who comes to your doors, who's going to see you as being, a viable resource for their community. But the short answer is yes, there is an expectation that you serve all victims of violent crime. And that's the last question. But Stacy, I'm gonna put you on the spot and make sure that you don't disagree or want to add on to any of the answers that I've given, because Stacy is absolutely an expert in this model, and I want to be sure that I'm giving you guys the best information.
Janelle, I don't have anything to add. We did just have one more question pop up in the Q&A. So
Awesome.
I will get to that next. And that is, what about contracting for street outreach as an example? So we would deliver the TRC model, but would have a contract for someone to do the street outreach.
You guys are just trying to trip me up, it feels like. No. I feel like I'm not the best person to answer this question, so I think that might be the second one that I have to take back and circle back to you on. We should be able to see who it is in the Q&A that submitted these questions, but if we're not able to track that, we will absolutely put it back out on the website. So look for that here in the next like 3, 4 business days. My apologies. Try to know it all, but I can't know it all.
No, did you want me to, that's the one question I feel like I might have something to add to, Janelle.
Yes, go right ahead.
Okay. I think, this model, as you said before earlier too, it really is about providing all of those comprehensive services in-house by the team. And so that's usually it usually doesn't means not contracting out for components of the model or components of the comprehensive services.
Yeah, that's fair to say. We do prefer you have them on staff. That's not to say you can't have those types of positions on staff, though.
Exactly.
So that's important.
Exactly. We've had a few more questions come in too. So the next one is, please define the other entities regarding higher education, private or public.
I'm not sure what that question's asking.
And then actually, there's the next question is very aligned with that also, which is, can you please define what private higher learning is? I'm not sure if folks are asking about private or public universities, or if this is something that we want to circle back to.
Yeah, we absolutely can. I mean, really, it's just meant to mean that institutes of higher education, private, public, or state controlled, are all eligible. I think this is almost pulled verbatim out of the OVC eligibility in this grant award. So I can go back and see if they provide greater clarity, and we can make sure that that gets listed on the website as well in the question and answer section. But my guess is most are going to be eligible to apply.
Okay, next question is, most of our employees are currently contractors. We absolutely welcome hiring them as staff if awarded. Is this a problem?
No, it sounds like you understand what we're trying to get at with the model, which is we really want that comprehensive care provided in-house. It can be incredibly disruptive if you have contractors leave and you have this transition, and you can't have that single point of care either, because it's kind of disjointed. It's not to say that folks don't provide great services, but it kind of diverts from the model. So yeah, we would just want to hear your plan for how you're going to hire those folks in.
Okay, next question is, we also provide housing and food for survivors to eliminate housing and food insecurity. Are funds allowable for this?
They are. Emergency financial assistance is something that's allowed. We typically restrict it to 5% of your overall budget, which is still a pretty good amount of money. But yeah, I would recommend going back and looking at the allowable costs, but things like emergency food, relocation, transportation, meeting emergent needs, really, if you can justify it, as long as it's not expressly disallowed, if you can justify it, we certainly are going to advocate for it to be something that you do for survivors. You're going to know best what a survivor needs. It's always great to check if you're worried so that if you don't run into something that's not allowable. There's also resources again on the appendices. We list the resources to the federal links. OVC has really built out their Vocapedia page, which fields a ton of questions around allowable costs just like this. So you may want to check there too to make, because I wouldn't doubt if they've already answered this. But what you noted is absolutely eligible.
Okay, the next question I think might have come into the chat at the same time as there was earlier discussion around the types of groups that can apply. And it is, I'm asking, referring to the 3 groups that can apply.
Feels like this is a clarification to the higher ed question.
I think so.
Yeah, I'm just not sure. I'm not sure. I'm not sure I understand what like a deeper definition of this would look like. So I want to be sure we're giving you the best information. Like I said, we took that language almost verbatim from OVC. So I don't know much more now, but we will make sure that we look into it and I can get you a better definition of what falls into public. And I think specifically you were asking about private higher education, institutions of higher education.
Okay. And then the next question is, what if you are a CVIP, HVIP organization that already are in full access to the client due to intervention work? Most interventionists are formally incarcerated, and will that disqualify those organizations because of the background check requirement?
This is a complicated question. Um, Stacy, I'm going to let you answer it from a clinical perspective because I am not somebody who understands all the, like, I don't have all the knowledge behind what might be required of the, like, literally of the profession itself around, like, reporting and all that. I can tell you for the purposes of the OVC grant, it really is about, for the most part, it's about protecting minors. And they are very specific about what crimes disqualify you or what prior convictions disqualify you from being able to serve youth victims. If somebody does not fall into those categories, then OVC has always said you as an organization get to decide who best should be serving clients. So there's only a handful of really prescriptive types of crimes where somebody cannot be funded to provide these services under federal dollars. Is there something more to add on the clinical side, Stacy?
I don't believe so. I think clinically it would align with everything that you just said.
So I think I mean, as somebody who's been around this work for a long time, we agree. Folks with lived experience bring a wealth of knowledge and expertise to this work, so we encourage you to hire them. I would just double check that federal resource. It should be in the federal parameters that we've outlined, I believe, in Appendix H as well. Those requirements will be things you will see in a contract as well that comes from us. They're all the things we have to pass through to you. So I believe we talk about that specific parameter that's in the grant really, really detailed. But again, there's other resources to point to. So I know that there are specific crimes. I couldn't name them for you, but I mean, they're kind of along the lines of like sexual assault of a minor, enticing a minor, trafficking kids, like things like that. That they're trying to protect for. But there are a whole other, host of things that could have happened in somebody's lives that will not discount them or exclude them from being able to provide services.
Okay, it looks like we've reached the last question. That was the last question in the Q&A. Unless there's
Wonderful.
anything else that people want to add. Yeah.
Well, thank you for sticking around. I'm going to be here. I'll wait a couple more minutes in case any other questions come in, but you're welcome to leave. We are excited again to be offering this opportunity. Hopefully, you're as excited to apply. Again, if you have any questions, reach out via the web form, and please, please, please make the deadline of December 22nd by noon Pacific Standard Time, 2 p.m. Central Standard Time. But thank you so much for attending the webinar today.
Yes, we did just have one more question pop up. Actually, a couple. The next one is, can a lead agency partner with another agency to refer clients? And can this partner agency be paid?
Well, that is a good question. That's not something I think that's come across my radar. Stacy, you want to weigh in?
I wonder if it would be the same as the subaward issue. And that it's, well, that's, I guess that's what I would wonder about.
Well, it's, if I'm hearing it right, it's a question of, can we pay them to refer clients? I think what I would want to understand is what you're paying for. Because again, we can't subaward, we don't want to see you subaward to provide services. So that's different than you engaging with them to refer clients. But those community partnerships should exist. I would want to better understand why there would need to be an exchange of money to refer clients to services you think they need.
And then the next question is, I understand that we need to submit resumes of projected staff. Is that correct?
You only need to submit resumes for staff you expect will fill positions that you're putting on the grant. So if you have a program manager or you expect a therapist is going to step into this role, folks who are already employed in your agency that would move into these roles and we would be supporting the costs of their salary and benefits. Those are the resumes we want to see. If you don't know who's going to be in a position, there is no expectation to submit a resume now. We'll get them once you've actually selected somebody.
I think you might have already answered this next question, which I think was correlated, kind of a part two, but I will just read it aloud here, which is from the same person. What if we don't have resumes yet, but understand that we need to hire specific staff for these positions? Do you recommend that we have the actual staff identified? Will we lose points if we don't?
No. No, you don't have to have the folks identified. If you already do, we want to know who those people are and what their backgrounds are. If you don't, we will get those. If you're successful in getting the award, we will get those at the time of hire. So there's no lost points if you don't include it. If you put a name in a position and you want that position to be paid under the grant, that's when we're going to expect to see a resume or CV.
Okay, looks like no more questions this time. Oh, nope, one more just came in. And here it is. We work with SMEs, contractors, and consultants to provide services and expertise for their benefit, our work and clients. For example, mental health counselors, trainers, etc., case management, mediation services, etc.
That is also a loaded question. The model is really meant to have a wraparound clinical team to support survivors who are on staff. There may be times where some of those contracted services would be eligible. I'm just struggling to think through what they would be. I feel like there were a couple things that got noted there, like trainers. I could see that if it's professional development for staff. Obviously it should still be reasonable and should fit into the core components and objectives of this grant. Mediation services, I think I would have to understand more. Other things that come up like legal services, like we know that sometimes there's a need for legal services for clients. So I do think there might be some things that could potentially be contracted for. But if you're looking at the core positions that we're asking folks to have within the UCSF model, TRC model, those folks should really be on staff. That's what we want to see. That's how the model is most effective.
Okay, and then the next question is there a recommended number of clinicians on the team needed to execute this grant?
That's a great question. We will fully acknowledge that we do not have enough money to be able to meet all of the needs that you will have through a TRC. So it's possible that you may have to figure out, how you're going to stretch that money in different ways. But when it comes to actual numbers, I don't feel like we say you have to have a specific number, but I'm sure there are recommended numbers. Stacy, if you would be so kind as to maybe weigh in here.
I think it's also a really great question. I think this is a comprehensive model and the ability to have mental health clinicians who are providing those services is core. So I would just say it's definitely not the only positions for sure on staff, but I think I would consider that in terms of the balance that you're creating with the staffing that you're putting together. You wouldn't want to have a lot of other roles and like one mental health clinician, for example. So I know that's not providing the exact number either, but just kind of making sure that comprehensive access is there.
Yeah, mostly I guess the way I look at it is when I see your whole plan, do I see that you could execute services once fully implemented based on the plan that you've put in front of us? And I think that speaks to what Stacy was just saying is the balance of across all of those positions.
Okay. Any other questions that people would like to add? I think
Okay.
so.
We appreciate your time. Again, we will do our best to get all of these questions put back out on the website so that you have them in writing. And I recognize we have a couple that we weren't able to answer. We'll definitely try and prioritize those. Thank you so much for attending.
Do you know, we had one more question just pop in. Should we table it or ask that or do that here?
Um, it looks like there's still a handful of people here, so I'm worried that person might be waiting for that answer. I'm happy to give it. Again, they'll be put out on the website for anybody who's left, so they'll still be able to get the information.
Okay. And that question is, what are the positions needed for this grant?
Oh, that's kind of what we were just touching upon. I would absolutely refer you back to that core, those 11 core elements. We outline the types of positions that we would expect to see. We don't expect to see all of them, but we do a good job laying out the components of the TRC, the staff members of the TRC that make it most effective. So it's in that core elements document. It's also in the TRC manual that's on our website that I pointed to. I would recommend you go there to look at what we recommend and figure out what it is you'd be able to do with the money available.
Okay, that's it.
Okay. Thanks to those that stuck around for those last few questions.